Professor Ariel Revel, MD, is a professor of medicine at Tel Aviv University and a visiting professor at Oxford University in the UK and Stanford University in California. He is among Israel's leading specialists in gynecology and obstetrics and has for many years been involved in IVF and minimally invasive surgery. The doctor joins us now to discuss a very important topic, cell therapy in ALS. It is great to have you, Dr. Revel.
Good evening. In Israel, it's evening.
It's good evening. First, our viewers who don't know already, what is ALS?
ALS is a neurodegenerative disease where people who are ill with the disease lose the function of voluntary muscles. These are muscles that we are trying to activate, and they don't work well. Slowly, the disease causes the deterioration in physical abilities until it is difficult for them to breathe, and then it becomes very difficult to keep people alive.
It's such a terrible disease, and for the families to watch the persons they love deteriorate like that. Tell us about your cell therapy treatments, though, for ALS.
So in recent years, I've joined the company called STEM, which is a cell therapy-based company. The company was started by my father. He's the winner of the Israeli Prize of Medicine. And he started the company based with people from the Weizmann Institute, where he comes from in Israel. And what we're trying to do is cure diseases using cells. And the first disease that we're treating is ALS. Also, we're working on diabetes, but tonight we're going to talk about ALS.
This is so exciting. Can you share some of the results of your first trial? What have you seen that leads us to feel that feeling of promise?
So what we're trying to do is inject cells that support the neurons. The neurons are ill, they are degenerating, and we're using astrocytes. What we're doing, we're taking blastocysts, which are made in the IVF lab, and were donated by a couple, and we can use those as stem cells to make any cell in the body. In our case, we're making astrocytes, and we're injecting them intrathecally, meaning into the CSF, the cerebrospinal fluid, like a lumbar puncture, like you do for an epidural, quite similar. And this was carried out in 10 patients at Hadassah Hospital in Jerusalem. And the first patients showed some slowing down of the disease. But as you know, in any research, the first steps are safety. And what we were very happy to see, that the treatment was safe. There were no complications, neither from the injection nor from our cells.
So what are your clinical trial plans moving forward? How can interested people get updates?
So I receive phone calls and emails every day from families from North America, from Europe, from Israel, to help patients, because it is a disease which is called an orphan disease, meaning there is no cure, there is no medication. There is supportive aid, but there is nothing that can cure the disease. And cell therapy is really a really serious hope for this kind of disease, for any degenerative disease. ALS is a model because I think cell therapy in the next decade is going to be one of the most important areas of medicine. So we hope in the next clinical trial, which is going to include 2 injections, it's probably going to be carried out in North America in combination with the FDA. And what we're hoping to see is that there is slowing down of deterioration.
This was super informative. Thank you so much for being here, Dr. Revel.
Thank you.
We'll be back with more after the break.